Hello, and welcome to everyone around the globe, and thank you for joining us today for PAI's webinar, where we'll be reflecting on the first 100 days of this second Trump administration. What we've all seen is significant damage done to global sexual and reproductive health and rights through aggressive funding cuts, harmful policy changes. And so what we've done today is brought together PAI's experts to help unpack what's really happening and help everyone here stay informed of what's going on the Hill and what this means for people around the world. A few housekeeping items before we get started. Today's session is being recorded, so if you have colleagues that were not able to join, don't fret, we'll be sending the recording after our webinar today. In order to submit a question, we have the Q&A feature featured along the bottom of the screen. It's a little box with a question mark in it. At any point today, if you have a question for our panel, go ahead and submit it. There will be a Q&A at the end, where we'll try to get through as many of those questions as possible. And then with that, I would like to introduce today's speakers. So I am going to start with introducing PAI's President and CEO, Nabeeha Kazi Hutchins. We're very fortunate to have her here today giving us some opening remarks. She'll join for the Q&A if possible, and then some closing remarks. We also have Rachel Clement. She is our Senior Director of U.S. Government Affairs, and she's joined by Craig Lasher, who is our Senior Fellow of U.S. Government Relations. So quite a team here to help us understand what's going on better. With that, I'm going to go ahead and excuse myself and turn it over to Nabeeha so we can get a better sense of what we're going to tackle today. Thank you.
Thank you so much, Katie. Good afternoon, and thank you all for joining us for today's discussion on the current context of U.S. government funding and the policies for global sexual and reproductive health and rights in these first few months of the Trump administration. This year marks PAI's 60th anniversary. For 6 decades, we have worked in partnership with civil society organizations, governments, advocates, and others around the world to advance policy and accountability for sexual and reproductive health and rights. As we reflect on this milestone, we do so in the context of a rapidly shifting global environment, one that requires strategic engagement, sustained advocacy, and great resilience. The current U.S. policy landscape presents significant challenges. We are seeing proposed reductions of up to 60% in global health funding for fiscal year 2026, a renewed enforcement of the global gag rule, and efforts to rescind $500 million in fiscal year 2025, which is for family planning funding and was previously appropriated by Congress. These developments represent a notable shift in U.S. global health leadership with direct implications for access to essential services for healthcare around the world. The scale of the impact is well documented in both data and from stories of those impacted, thanks to organizations like the Guttmacher Institute, Reproductive Health Supplies Coalition, PAI's own programming, and many others were able to share the implications of the impact numbers today. The figures reflect the tangible results of sustained investment in evidence-based global health interventions and the catastrophic harm and ongoing risks when those investments are stripped away. I also want to underscore that support for international family planning and reproductive health has historically been a point of bipartisan agreement, anchored in shared values of human dignity, smart investment, and global stability. From the earliest days of the United States Foreign Assistance Act in 1961 through recent decades, lawmakers from both parties have understood that supporting women and couples to make voluntary and informed decisions about their reproductive lives leads to healthier societies and more stable communities. Republican and Democratic administrations alike have supported these programs, not only because they save lives, but because they reflect the best of American leadership and moral responsibility. Today, Rachel and Craig will provide a more detailed overview of recent policy decisions, legal interpretations, budget proposals, as well as the implications for U.S. engagement in global SRHR. At the same time, it's important to recognize the evolving domestic context in the U.S. The recently enacted One Big Beautiful Bill includes provisions that block Medicaid reimbursements for essential health services, such as birth control, cancer screenings, and STI testing, if they are provided at facilities that also offer abortion services, and Planned Parenthood has been intentionally singled out. It is important to clarify that Medicaid has long been prohibited from covering abortion services under the Hyde Amendment. This new restriction does not change that. Instead, it goes further by denying reimbursement for other forms of care solely because abortion services are available at the same site. This structure may seem familiar to many of us who work in global SRHR because the structure mirrors the intent of the global gag rule, a policy that was traditionally applied to foreign NGOs by creating a domestic parallel, a funding penalty that's designed to limit access, to constrain providers and pressure health systems to choose between comprehensive care and financial survival. The result is reduced access to essential services and a chilling effect on institutions committed to delivering rights-based, medically appropriate care. More broadly, civil society organizations in the U.S. are navigating increased uncertainty and increased scrutiny. This includes operational and legal questions related to compliance, funding restrictions, and advocacy parameters. The result is a more cautious operating environment that may affect the ability of organizations to engage fully in rights-based healthcare, both domestically and internationally. Now, despite these challenges, we still see public support for reproductive health and international assistance. More than 60% of Americans support reproductive rights, and close to 90% support maintaining foreign aid, particularly when it addresses urgent health needs. Recent ballot measures across diverse states have confirmed the salience of reproductive rights and reproductive autonomy among U.S. voters. This session will provide an overview of the current political and policy environment, outline the risks and opportunities for advocacy, and discuss how civil society, policymakers, and so many of you joining us from across sectors can coordinate to protect and advance SRHR in a constrained and complex landscape. So thank you so much for being here, and now I turn it over to Rachel Clement.
Thanks so much for grounding this discussion in all that has been and all that is, Nabeeha. I wanted to start by just talking a little bit about why U.S. family planning assistance matters. I think first and foremost, this work matters for the individuals and the couples who have relied on U.S.-funded contraceptives and reproductive health care, which was abruptly dismantled and targeted by the Trump-Vance administration. The United States was previously the largest donor of family planning, accounting for approximately 40% of total government funding for global family planning, and was responsible for providing contraceptive commodities, healthcare services. These numbers that you see here are from the Guttmacher Institute and estimate that 47 million women and couples received contraceptive services in FY24 alone, that 17 million unintended pregnancies were prevented, 5.2 million abortions, most of which were unsafe, and 34,000 maternal deaths related to childbirth and pregnancy were also prevented. Those are huge numbers. That's a massive impact for very little of our foreign assistance. And so I think it's just important to ground all of this discussion in the bang for the buck that we get, the lives saved, the life changed, the ability of women, couples, individuals to have bodily autonomy and choose when, if, and how many children they want to have, just can't be understated. In the first 6 months of the Trump administration, on the next slide, we saw reproductive health sort of uniquely singled out and targeted. Day one of the administration, there was an announcement that all foreign assistance was going to be frozen for 90 days as a part of a review. Other administrations have done reviews without completely freezing aid. This was an unprecedented move. It was very shortly thereafter, a stop work order was issued, not just on new awards, but on existing awards. The U.S. also quickly announced its intention to rejoin the so-called Geneva Consensus Declaration. This is an anti-sexual reproductive health and rights political statement that seeks to undermine not just reproductive freedom, but also multilateralism. And 7 days after the inauguration, the administration began mass terminations of USAID staff and USAID programs. There was some outcry from both the Hill and the American people following these actions, after which the State Department announced that there would be a humanitarian waiver for life-saving programs. Family planning was specifically highlighted as being ineligible for these waivers and not being life-saving. And I just think that that's kind of an important distinction, especially given the statistics we just saw from the Guttmacher Institute on how many lives are saved through reproductive health services. They also reinstated the global gag rule. This is normally something that's done under Republican administrations and is normally kind of a big talking point for an administration. This year it was done with very little fanfare. I think given the timing of the announcement, that it just wasn't headline making, the lack of programming and staff to support the limited programming that was still happening, in some ways made the global gag rule moot, at least, initially, as it would prohibit global health funding for organizations that offer abortion services, counseling, or conduct advocacy to legalize abortion with funding from non-US government sources. We will talk about the continued threat of the global gag rule later. By February, USAID is dismantled overnight, its website taken down, all of its resources gone. Really shocking, the aid sector. By the time the dust settles, thousands of experts will have lost their jobs, and almost all family planning focused aid work has been stalled. During the first 3 months of the freeze, researchers estimated that 11 million women and girls would be denied contraceptive services and that over 8,000 preventable deaths will have occurred. By May, the White House releases their presidential budget request. Under any White House, a presidential budget request is more a statement of policy and priorities than it is sort of an exact funding request that is meant to be enacted. But it is important to note here that the White House proposes a 60% cut to global health. And simultaneously, as the Secretary of State, Marco Rubio, goes to the Hill to discuss the budget, he admits that he will not spend the family planning reproductive health funding that has previously been appropriated by Congress, and says that we're no longer in that business. They terminate funding for UNFPA and justified these cuts and proposed cuts by saying that family planning and reproductive health do not make America safer. At the same time that they're proposing future cuts to funding, the government announces that they hope to claw back $9.4 billion in funding from the previous fiscal year, $8.3 billion of which is foreign assistance and $900 million of which is global health. This process, known as rescissions, is a formal process where the administration requests the permission of Congress to cancel funding that they've previously approved. There has not been a time where this extreme of a rescissions package has been proposed on foreign assistance, but it is a formal process that has existed since the Ford administration in the 70s. There is a separate part of the rescissions package that I also rescinds the entire amount appropriated in FY25 for the International Organizations and Programs account that funds all U.S. voluntary contributions to UNFPA, UNESCO, UNICEF, other UN agencies. Also in May, the Trump administration decided to terminate funding for UNFPA utilizing the Kemp-Kasten Amendment and determination. And while the determination to terminate funding for UNFPA has been utilized under previous administrations, the loss of both core and humanitarian support for UNFPA, alongside these proposed cuts and rescissions to the UNFPA and other UN agencies, is going to have devastating impacts, particularly in the conflict and crisis settings where UNFPA is often the only provider of reproductive, maternal, newborn, gender-based violence response, other care and commodities. What we understand so far is that nearly 50 grants have been impacted, and total nearly $377 million. This is just, another demonstration of some of the inconsistencies in which this policy application has taken place under this administration. Of the grants that were terminated, I think there were 48. 16 of those had previously received a humanitarian waiver. So even though family planning and reproductive health were listed as non-life-saving, some of the work that UNFPA did was able to receive a humanitarian waiver, but then was later terminated under this ChemCast indetermination. That just creates a lot of chaos for multilateral agencies, countries, implementing organizations, and the end users of these services and commodities who can't count on the US to be a consistent partner anymore. By June, Russell Vought, the OMB director, confirms that 500 million of the rescissions package is specifically targeting family planning and reproductive health. Given that there's about 600 million appropriated for family planning and reproductive health every year, that is a huge amount to be rescinded. And just to add insult to injury, reporting in June showed that millions of dollars in reproductive health commodities are trapped on ships and ports and warehouses around the world, and that the Trump administration, rather than giving these to the end users or selling them to recoup some of their money, plans to destroy these commodities. This effectively means that the US would rather erode the reproductive decision-making abilities for millions of people and waste taxpayer dollars rather than recoup the money that they've already spent in purchasing these commodities and shipping them around the world. And just demonstrating again that despite repeated talking points around foreign assistance, changes being about waste, fraud, and abuse, it was never really about that. So I think, to just put a finer point on it outside of the timeline, there are really three main areas where sexual reproductive health and rights have been affected in the last 6 months. Women and girls' lives have been upended, not being able to choose if, when, and how many children you're going to have, not being able to access care, not being able to access some of these safe spaces where women and girls go following sexual assault or for regular care in conflict and crisis settings, just has enormous impacts on individuals and their futures, and has left just chaos in the sector as a whole. We've also seen free speech really curtailed. This has had a really chilling effect on advocacy and evidence-based care, both from US-based NGOs and NGOs based in countries where they're afraid of upsetting the US government and potentially not being eligible for future funding if the spigot is ever turned back on, or if they receive funding in other areas. Our US-funded organizations are just afraid to speak out. And many reproductive and other rights have been erased in name or action under the guise of compliance with the US government. We're already seeing contraceptive stockouts and just massive disruptions to systems and supplies. Because this happened abruptly and without consultation with these countries and in the middle of many countries' fiscal years, it's just been impossible for nations to shift their own national budgets to try to fill these gaps. The US controlled a massive part of the supply chain. So even if the funding were available, US control of the supply chain has made a lot of work impossible. And US policy is just influencing other national health priorities in other donor countries. I'm going to pass it to my colleague Craig now to really talk about appropriations and what this has looked like.
Thanks, Rachel. Yeah, as you see before you, a chart on family planning and reproductive health budget requests and appropriated levels since 1978. As Rachel said, Trump's first budget request zeroes out all bilateral, multilateral family planning and reproductive health funding. Historically, president's budget requests, regardless of party or congressional control, have been dubbed "quote unquote" dead on arrival and routinely ignored by Congress. The Trump budget request for international affairs programs is uniquely bad, and House Republican Appropriations Committee sycophants have publicly stated that they will draft bills to Trump's top line, which would be brutal, as the international affairs budget has been subjected to one of the deepest and most disproportionate cuts of any budget function. For family planning and reproductive health, Trump is the only president to propose zeroing out all funding. Initially, in his first budget during his first term in fiscal year 2018, and now in his budget of his second term. In his first term, even in subsequent years, he came in at less than half the prior year appropriation. As you can see on the chart, maybe it's a little, actually the horizontal axis looks better. As you can see on the chart, there's a large trough during Trump's first term, the orange line between FY 2018 and 2021. Congress, as you can see in the gray line, has routinely appropriated money at a much higher level. So the horizontal line, the gray line between FY 2011 and FY 2025 represents level funding for the last 15 years, where FPRH funding has been stuck at just over $600 million, about $575 million in bilateral programs, and a $32.5 million voluntary contribution to UNFPA out of the International Organizations and Programs account. Although it's great that we've been able to maintain a constant level, it's important to remember the pernicious effects of inflation. If you use FY 2011, the start of this 15-year level funding in current dollars, it represents a 30% reduction in purchasing power. And if you were to adjust the FY 2011 level for inflation, it would be just over $825 million today. And if you look at the high water mark in congressional appropriations in FY 1995, just after the Cairo conference in 1994, that amount would be the equivalent of 1.25 billion today. So historically, there has been a lot more political will and resources devoted to family planning and reproductive health. We've been encouraged by Democratic appropriators not to back off on the needs-based ask that we've been promoting for the last several years, in which we propose a near tripling of funding based on the U.S. fair share of the total cost of meeting the unmet need for contraception of 214 million women in low and middle income countries. But we would be delighted if a statutory funding floor at a reasonable level could be included in the FY 26 appropriations bill. Colleagues at USAID have stressed the importance of maintaining a line item budget for family planning in the appropriations bill, even if there's no staff currently to programming it. So preservation of an earmark for family planning and reproductive health funding is the advocates' number one priority. Next slide, please. Threat watch or looming threats. I'm going to try and summarize this. I may go on a little while. It's stuck on one slide. but I'll try and summarize, and you can ask additional questions during the Q&A. So these are the 6 key threats that we're paying attention to. So the FY26 appropriations process has finally begun, but it faces uncertain prospects. The start's been delayed by House and Senate consideration of the massive reconciliation bill that cut Medicaid and supplemental nutrition and assistance to pay for tax cuts and to fund large increases in defense and border security. But the appropriation process begins a backdrop that's important to highlight. It includes a Trump administration that has openly challenged the power of Congress to direct federal spending and the constitutionality of the Impoundment Control Act, essentially questioning Congress's power of the purse. The illegal closure of USAID and other federal departments and agencies, and the firing of tens of thousands of federal workers as a result of the vandalism of Elon Musk's so-called Department of Government Efficiency, an Office of Management and Budget in the White House that is illegally withholding tens of billions of dollars in congressionally appropriated spending and ignoring the long-term fiscal year 2025 CR that Trump signed back in March. So the House Appropriations Committee was scheduled to mark up the fiscal year FY26 State Department Foreign Operations Appropriations bill the last week of June, but it was abruptly canceled and not rescheduled, not for any reasons related to the bill itself. But in previous markups of other subcommittee bills, House Republicans have been drafting bills at the Trump budget request level, to which Democratic appropriators have vigorously objected. The extreme level cuts so far that have been included in House subcommittee bills will not fly in the Senate. Advocates fully anticipated that the chairman's mark produced by the Republican majority that will be marked up will significantly cut, if not zero out, bilateral family planning and reproductive health funding, prohibit funding for the UN Population Fund from any account, and legislative codify the expanded Trump global gag rule. Democratic champions will offer pro-SRHR amendments during the markup to strip out bad provisions in the chairman's mark and replace with positive funding and policy provisions. Unfortunately, such Democratic amendments are destined to fail on straight party line votes. We do have some ideas, which I'll get to later, about maybe a new approach, at least on one issue, specifically the contraceptive waste, fraud, and abuse that Rachel referred to. On the Senate side, they've only this week have begun to consider FY26 bills, but it's unclear so far if committee chair Susan Collins and Democratic ranking member Patty Murray, they have not revealed, but presumably there's an agreement has been reached between them on the top line spending allocation. And it's widely assumed that the Senate allocations will much more closely mirror current spending levels as opposed to writing to the Trump budget request. If and when the Senate Appropriation Committee marks up its version of the state foreign ops bill, advocates would anticipate that amendment will be offered in full committee if necessary to ensure adequate funding for both bilateral and multilateral family planning and reproductive health programs. This has been the practice for more than a decade. This sets up the annual dynamic for the negotiation between the two chambers. how the House and Senate will reconcile their widely divergent views toward the Trump budget requests remains in great doubt. It's all but inevitable that a short-term continuing resolution will be necessary to keep the federal government operating at the beginning of the fiscal year on October 1st. And a government shutdown this fall is not out of the question. The other appropriations related piece of legislation that we're following closely, and Rachel referred to it in her discussion of the timeline, is the rescissions package that has been requested by the Trump administration to claw back previously appropriated FY25 funds for foreign assistance and public broadcasting. As Rachel made reference to, one of the proposals within the package was eliminating $500 million of global health programs account funds. It was unclear until the director of OMB, Russell Vogt, testified before the Senate Appropriations Committee that the entirety of the $500 million cut in global health programs was from family planning and reproductive health. Advocates will be educating senators on the impact of a cut of that magnitude. The House passed this rescission package presented by the administration, largely unaltered, back in mid-June, and it's now before the Senate, where it faces an uncertain future. Interestingly, under the rescissions process, Congress has 45 days to approve a rescissions proposal once submitted, which means the deadline for Senate action is midnight of July 18th, so a week from Friday. Failure by the Senate to act is an option, and it's actually the best one for us, because if they don't approve it, the Trump administration will be required to spend the funds that they proposed to be clawed back. Advocates for international affairs programs are pulling out all the stops to try and block Senate passage of the rescissions package. If the rescissions package were to pass, it would upend the tradition of bipartisan cooperation on appropriations bill. So this is a key watershed moment, really. Senate Republican appropriators are being reminded and urged to reassert their constitutional prerogatives and defend the federal spending allocations that they fought to obtain for their states and constituents during last year's appropriations process, completed just 3 months ago. And with so little detail on the rescissions proposal itself, like I said, no one knew that the entirety of the $500 million proposed for cuts in the global health programs account was to come out of family planning until Russell Vought testified to that effect. So with so little detail in the proposal, passage would afford the Trump administration unbounded flexibility to allocate the cuts, which ought to trouble Republican appropriators who think they can protect their priorities. As I said, if the Senate doesn't approve the rescissions package by midnight next Friday, the Trump administration will be legally obligated to spend the appropriated funds for the purposes for which Congress originally designated them. Whether they will is an open question, however. at the same time as we're trying to preserve funding for family planning and reproductive health, you have the absorption of USAID into the State Department on July 1. Former USAID and state officials are predicting an impending train wreck. The State Department will have to absorb what remains of USAID programs and are not ready to manage these programs with a staff that is just 6% the size of the USAID's former workforce. This absorption takes place in the midst of a reorganization, and the State Department is facing its own imminent staff reductions and budget cuts. So we think that there will be responsible appropriators of both parties who will push for adequate operating expenses and staffing to ensure that the funds that they appropriate are effectively managed. And there's some speculation that this is a deliberate attempt to sabotage what remains of 6 decades of U.S. government foreign aid architecture. Rachel referred to the destruction of contraceptive commodities. As you may have seen in press reports, State Department officials are contemplating destroying 9.7 million in contraceptive commodities sitting in a warehouse in Belgium, rather than transferring them to an experienced international organization and recipient governments to distribute. And if they decide to destroy them, it will impose an additional cost of $167,000. It's rumored that such a decision to destroy those supplies has already been made. There's an additional $9 million worth of contraceptives and HIV prevention drugs sitting in warehouses in recipient countries. Informed observers suggest that the value of contraceptive supplies already paid for by the U.S. government are currently in limbo, and the risk of expiration and destruction may be closer to $40 million when the estimate includes supplies purchased but remaining at the manufacturer and not shipped, as well as those that are in transit. This obvious example of waste has caught the attention of congressional SRHR champions on the Appropriations Committee. Advocates have drafted an amendment for full commodity markup in the House that would prohibit the use of appropriated funds for destruction of pharmaceutical commodities and medical supplies. Although the amendment will not pass, it is hoped that it would expose the hypocrisy of Republican concern about waste, fraud, and abuse in the foreign aid program. Rachel is helping to organize a briefing for the Reproductive Freedom Caucus in the House on the situation, featuring reproductive health supplies experts from the NGO community, a former USAID official, and a multilateral organization representative next week. In addition, a bill to amend the Foreign Assistance Act has also been drafted for introduction in the Senate that would similarly constrain the actions of the executive branch in the disposal of commodities purchased by U.S. taxpayers. Rachel also mentioned in her discussion of the timeline the Geneva Consensus Declaration. On the same day of the presidential memorandum reinstating the global gag rule, Secretary of State Rubio issued a press release declaring that the United States would rejoin the Geneva Consensus Declaration. Geneva Consensus Declaration is an anti-sexual and reproductive health and rights document created out of whole cloth by first-term Trump political appointees that seeks to supplant authentic international agreements like UN Human Rights Conventions and the 1994 International Conference on Population and Development Program of Action. The U.S. representative at recent executive board meetings, both UNFPA and UNICEF, have recently touted the Geneva Consensus Declaration as the new U.S. policy orthodoxy in international fora. We've heard reports that countries are hearing from the Trump administration and conditioning aid based on whether or not the government will sign the declaration. Interestingly, opponents of family planning in the past frequently accused USAID of conditioning aid on the government's agreement to accept family planning assistance. This is likely another case of opponents' accusations being confessions on their part. Potential expansion of the global gag rule. I'm sure this is a topic of significant interest to, in particular, any implementers that are on the call. Despite the fact that Trump signed a presidential memorandum on January 24th, reinstating the gag rule on foreign NGOs receiving U.S. global health assistance, there have been no known instances in which implementing organizations have been presented yet with new standard provision implementing the restrictions. However, there are strong indications that political appointees within the administration are continuing to work to implement the presidential memorandum and to expand it. But expanding the eligibility to additional types of foreign aid beyond global health or on funding recipients previously exempt, such as U.S. NGOs, international organizations, and bilateral government-to-government agreements, as called for in the notorious Project 2025, remain very much on the table. Some suggestions of where political appointees within the Trump administration may want to go with the expansion may be found in language presented to implementing organizations that receive limited waivers for certain types of HIV activities during the 90-day foreign aid pause. Implementing partners were asked to accept additional terms and conditions on their existing contracts that were heavily focused on ensuring that no funds were provided for abortion, family planning, or activities that are contrary to some of the executive orders that have been issued by the White House, such as those on gender, DEI, and transgender surgeries. One could also look to policy riders included in state foreign operations appropriations bills adopted by the House Republican majority the last 2 years for potential types of additional activities that might be targeted for expansion of eligibility conditions related to LGBTQI, DEI, and gender programs. In fact, House Republicans included a global gag rule like eligibility condition for organizations that provide gender affirming care, even if done with non-US funds. The timeline for potential expansion is uncertain, but release of a new policy directive is not expected to be imminent. Sorry, I went on for so long. Next slide, which is somebody else's.
No, Craig, I think that's great. I think it's important to note, not only the detrimental actions that have taken place in the first 6 months of this administration, but that they're not done. There are a number of threats that we're eyeing, and they're overlapping, and the harm is just going to increase exponentially if these potential threats are enacted. So I really appreciate you spending some time on those. Wanted to spend just a little bit of time trying to lighten the mood since we've been sort of trauma dumping on you all, but want to start with PAI and what we're doing. We're really focused on the Hill at this point. We engage regularly with bipartisan offices, and we're pushing for members to reject the rescissions package, full stop. It's our assessment that the rescissions package is a test and that congressional acceptance of such a drastic and draconian cut would invalidate future appropriations negotiations. Craig talked about that a lot. But if an administration can just undo the directives from Congress on spending, the role of the 3 co-equal branches of government is forever changed. And we in our analysis, think that they are sort of testing the waters with foreign assistance because it tends to be an issue that not as many Americans call their members of Congress about, and there hasn't been as much outcry about foreign assistance being gutted as there was from, say, changes to Medicare or Medicaid. Of course, that isn't to say that the $500 million cut that's being proposed within rescissions wouldn't also have immediate and devastating impacts, because it would. But I think as part of a broader picture and longer term vision, it's a really bad move for Congress to approve that package. So we're working every day with members of Congress and their staff to ensure that they're informed, engaged, understand exactly what we're seeing, that they're aware of, as we said, the commodities situation and the potential destruction thereof, the ways in which some of these talking points and myths and disinformation about family planning, reproductive health, what it does, why it's important, why it should matter to Americans, are pushed back against, so that accurate and timely information is getting to the Hill, both from PAI and the partners that we work with in country and around the world. We are also working on appropriations and legislation, just Hill work, to preserve international family planning, reproductive health funding. And we don't do this alone. We work with a number of DC-based NGOs, and we lead a number of coalitions here in DC that align and work on coordinated advocacy priorities. Craig is, as you've seen, just a font of information. If you want more of that kind of in-depth analysis, he puts out a Washington memo about once a month, although sometimes that timing is different based on what's happening on the Hill and with the administration, called the Washington Memo. Please do sign up to receive that in your inbox. It's just a really invaluable resource. We also will continue to put on webinars like this, briefings, and to have policy briefs. Those can all be found on our website under resources. And then last but not least, we are building out a plan for U.S. constituent engagement on global SRHR. As I've noted, we're just not seeing some of the same constituent engagement on these issues. We know Americans care about reproductive freedom. We know that when polled and asked, they're supportive of foreign assistance. There is just a huge misconception about what foreign assistance does, how much taxpayer dollars, like what, as a percentage or a dollar amount, go abroad, why we do foreign assistance. And so we're seeing a real nexus of potential here, where we could get greater constituent engagement on global SRHR, and also where there's a huge need for people to be informed and aware of where their taxpayer dollars are going, or in this case, potentially not going moving forward. And then on the next slide here, we just wanted to touch a little bit on not just PAI, but what the sector can do to move forward. We still firmly believe that the U.S. government needs to contribute its fair share to address the unmet need for modern voluntary family planning through foreign assistance. And we are going to continue to push the U.S. government to do that. As I noted, we think the American public needs to be really engaged and supportive of foreign assistance and its critical role in advancing global sexual reproductive health and rights. At the same time, we see this as a moment where we are hearing from many of our country partners that, maybe one country shouldn't have this level of control in the global supply chain. And maybe there are opportunities here for greater domestic investments in the form of countries being able to control some of their own supply chains funding and allocate funding so they're less dependent on U.S. investments and the whims of any U.S. administration. So we're working to support our non-U.S. partners as they work to increase that funding, and hope that other organizations and entities are doing the same. At the same time, we do need to recognize that we need to advocate for reliable and stable financing architecture through debt relief, innovative financing, equitable tax reform, and more, to ensure that we're really fully funding and supporting sexually reproductive health and rights globally. I think I saw someone in the chat note that some countries are not able to fill the gaps left by the US government. And that is true. We have a number of partners who have noted that their governments are not able to mobilize or change the way the funding is allocated and appropriated domestically, and that there are much bigger sectoral reforms that need to happen. And so leveraging this as a moment to have those conversations, I think our sector loves to talk about working ourselves out of a job and sustainability and country ownership. This is not the way to do it, just abandoning our partners. But if there is a moment to have some of those big, bold conversations, I think it's definitely now to think about what the future looks like. And yeah, I saw that my colleague put the Washington memo and newsletter sign up in the chat, so please do check that out as well. So it looks like we have a couple of questions. Christine, I see a question on why the United States should, why they're considering destroying contraceptive commodities while people are in need and not able to allocate funding for family planning. I don't disagree with you. I think this is a horrible waste of commodities, taxpayer dollars, and just global good. It's a little bit unclear exactly why the United States is considering this so strongly. From public reporting that we've seen in the Washington Post and elsewhere, we are aware that there has been quite a bit of internal conversation within the US government as to why they are considering destroying this. One reason given, one rationale that has been floated is that the commodities are labeled and say, from USAID, courtesy of the American people, kind of that branding, and that the branding would need to be changed to be distributed. That seems like a pretty spurious argument to me. And Craig, I don't know if you want to add to that, but it seems that relabeling could happen pretty easily. Again, in that public reporting, we've seen that there have been some negotiations between various countries where they've tried to buy those commodities that were previously purchased by the US government. So US would actually get some of its money back, and that those proposals have been rejected. It just seems like cruelty here might be the point, and not any real desire to prevent waste, fraud, or abuse, or kind of any of the reasons that have been given. But I'll also note that this reporting is very dependent upon like whistleblowers and anonymous sources within the US government. The State Department declined to make a statement, and we haven't had anything publicly from the administration talking about this. We only know about this because of investigative reporting.
Yeah, the only thing I would add is that if in fact they're going to destroy them, it's an ideologically driven decision. Just highlights the depth of their antipathy toward contraception, not even abortion. It's they're going after modern contraception at this point.
Thanks. And thanks, Rachel, for jumping right in with the questions. I was so eager to get started on the webinar, I didn't even introduce myself. So I'm Katie Onthank. I'm the Communications Director at PAI. And we've received a few more questions from folks. So I'm going to throw them out there. Craig, Rachel, feel free to chime in. So the first one we have is, with Congress divided on global health and development, how has PAI worked to educate policymakers and defend critical funding and evidence-based policy for family planning in this new political landscape?
Why don't you do that, Rachel?
I think the onslaught of information and change that has happened in the first 6 months has candidly made this work incredibly challenging. Our colleagues on the Hill have a number of priorities to pay attention to, and the impacts of these cuts to foreign assistance have just been devastating. And I've been really proud of the work that PAI and our coalition partners have done to ensure that family planning is consistently part of the conversation, that we're working with staff to uplift stories we are hearing from the field, that when we have data, we're able to share that, and that we're submitting, questions for the record, having briefings with Hill staffers, doing other things to just even, in those early days when there was so much chaos and confusion around funding being frozen and then programs being terminated and then unterminated and then terminated again, but then not terminated, but partially changed, that we're bringing those stories to Hill staffers, because what they were hearing from the administration was, oh, this is just like a systematic review. Everything's happening through this normative process. And that just wasn't the reality. For a while, even organizations receiving humanitarian waivers weren't receiving payments because they turned off the payment system. And so they couldn't pay organizations who had done work in like December and January, much less work for their waiver that was ongoing. And being able to bring that real-time information to Hill staffers was so critical. And I think our voice and the voices of our coalition partners was really needed in that moment. But it's tough. It's really tough when there's this much noise and this much going on all the time.
Anything you'd like to add, Craig?
I mean, the other thing that that's hampered our collective efforts is, a number of our coalition colleagues have lost dedicated government relations staff, and so there's a less of a cadre of advocates than there was before the inauguration. And those that remain are stretched thin within their organizations because of layoffs and the volume of attacks that are coming toward implementing partners that were U.S. government funding recipients.
Thank you. Also, just a mention to folks attending. If you are raising your hand, please lower it and put it into the chat, and we are happy to answer it, or you can use the Q&A at the bottom, whichever I see first. So another question, and I was wondering this as well. So with so many of our civil society partners and just civil society in general, being fearful to speak out, how is PAI ensuring that those voices in the field are still being told on the Hill? How can others ensure that stories are still being provided to U.S. policymakers, and to really make sure that women, girls, other communities are staying at the center, even among all these horrific threats to foreign aid and funding here in the U.S.?
I mean, I think we're persistent and consistent. That is one of the most amazing things about working at PAI. We don't accept U.S. government funding. So we have not had some of the same restrictions that some of our peer organization colleagues have. And we've really been able to consistently leverage our voice, in a measured and evidence-based way, which we think is really important in this moment with so much harmful rhetoric and misinformation coming out, to just continue the drumbeat of this is the reality, this is what we're hearing, this is what the data shows, and this is why this matters. I think being able to tell that story both through like pragmatic evidence-based data, but also through stories has been really, really critical. I'm also really grateful to a lot of the reporting that has happened in traditional media, being able to point to, for example, that Washington Post article on commodities makes such a big difference and is so important and critical to our work. more so than just sort of rumors and hearsay and things that I may have heard through peer colleagues, being able to point to something public, I think is just really, really critical. So grateful to legacy media for continuing to prioritize and cover these issues as well.
I'm going to actually flip the script really quickly. I have a question for those who are attending. So from PAI, oh, hi Nabeeha, thanks for joining. Was there anything you wanted to add from the prior question?
No, I just really am looking forward to getting feedback on the next question you're going to ask from us.
Perfect timing.
Yeah.
So our question, as we continue our policy analysis and share these implications with the community in the coming months, are there specific areas or topics or issues related to USG and repro health that you'd like to learn more about, have interests about, or would find any kind of insight valuable? So please put them in the chat. We really do want to respond to your needs and what kind of information would be helpful to you in your own advocacy work. Anything that any of you would like to add?
Well, I think just, as additional context, while our guests are thinking about what they may be curious about that we have not presented or shared, whether that's today or in our ongoing content, is I recognize that, Craig and Rachel have incredible access to a lot of stakeholders on both sides. And so we have the opportunity to ask some of the questions that we're able to ask given our positionality and want to, of course, be in service to the movement and our broader community. So that's a little bit of the context behind this, is hearing what interests you, knowing also we'll do the things that are tried and true and that we certainly want insights on, but also very much welcome your feedback. So please do put it in the chat so we can keep our eyes and ears open as we do our daily work.
I'm also adding to the chat, if you have feedback, maybe it doesn't come to you immediately right now or comes to you later, you can shoot us an email at info@pai.org. If you have questions for our speakers, anything that comes to mind, you can reach out and we'll get back to you within 24 hours. So as we have our attendees thinking about that, let's put another question. Okay, so we had someone attend our post-election webinar, which was a bit depressing and very shocking. And this person was shocked at the predictions that we made at the time. And we're concerned that we were being unnecessarily fearful. It looks like in the reality, it's actually much worse than we predicted then. So the question they're asking is, how did we anticipate these policy shifts that would threaten access to family planning? And are we able to do that now to, look at the next 180 days and anticipate what's coming down the line? And with having that kind of, fortune telling of knowing what's coming, how is PAI kind of responding quickly in response to what we're seeing?
I mean, I think my answer would be sort of similar to what I said before. I think things have been shifting so rapidly and in some ways in such unanticipated ways that we've had to been really nimble in our responses, and we've had to think really creatively about the best way to get information to the right stakeholders. I think even our worst and most dire predictions didn't predict USAID being dismantled overnight. Just the misinformation that was promulgated by DOJ with their wall of receipts, a lot of the talking points that we've seen specifically around contraceptives and the language around it's not being like an American value or American priority. I don't think we could have anticipated it. So I think it's also perhaps a lesson that like it's good to plan and it's good to prepare, but you also have to just react and be nimble. And I think we're also in a moment now where we're looking to the future and we're thinking about being more proactive as opposed to being so reactive to the things that the administration has done. But yeah, no, that was a very depressing webinar. I hope this one is slightly less depressing and that folks are leaving with some hope for the future. I do think that we are really looking forward to what can be done and ways to engage folks, and would love to continue this conversation with all of you that are online today, because I do think this is going to take all of us engaging. This is not just a PAI role. It really is going to take civil society, the public, and Congress acting together.
Awesome.
Yeah, I would agree. And I mean, no one predicted how bad it was going to be, including Trump political appointees in the first term. I was at a round table just prior to the inauguration, and all that they were looking for, um, and clearly they were not in the loop, was a more transactional approach to foreign aid, perhaps modeling the compact structure of the Millennium Challenge Corporation, where there's a contractual relationship between the U.S. government and the recipient country. But no one expected what took place, very early on in after the inauguration.
Thank you. Actually, Rachel, right back to you. When you said proactive, what does that look like for PAI and other SRHR advocates?
Yeah, I think without giving away too much of our future plans on a recorded webinar, this looks like working with members of Congress and their staff on legislation and to insert specific language in appropriations text and other areas that would protect and promote reproductive rights globally. But just trying to get away from the always reacting moments that we've had, kind of at least in the first 3 months, I would say, particularly of the administration. Craig, is there anything else you want to add there?
Well, I would say that if in fact an amendment on contraceptive waste, fraud, and abuse does end up getting offered, I think that that's an example of a proactive strategy. I mean, it is in part reacting to a horrible situation, but nevertheless, I mean, I think you need to take advantage of opportunities presented to you where there's open political openings to if nothing else, send a message, even if it doesn't become law. I mean, we're also discussing the drafting some proactive bills to retake the high ground, in particular on issues like reproductive coercion. So, it's not entirely reactive, but trying to exploit the opposition's vulnerabilities.
Thank you. It looks like we have time for one more question. And this one is a good one, considering our background here at PAI. Craig and Rachel, could you comment on what you're hearing from U.S. global health assistance recipients on what they're hearing from USG agreement officers on how and when the GDR/Mexico City policy/protecting life and global health assistance will be implemented? And what actions do you think implementing partners will be expected to undertake to demonstrate their compliance with the policy? So a little bit of.
So until this morning, we hadn't heard of any U.S. government representative approaching an implementing partner on implementing PLGHA, and we're still we still need to understand the situation better, but there doesn't appear to be, for example, no implementing partner has been presented with a revised standard provision to be included in their grant or cooperative agreement so far. And to the best of our knowledge, a new standard provision has not been drafted. I think we won't know what compliance looks like until we see the actual text of a new standard provision. I mean, we haven't even seen a reissuing of the 2017 standard provision. So yeah, I think it'll all depend on, you know, how the policy and eligibility condition might be expanded. But as far as I know, implementers are not hearing from agreement officers. But I would welcome any information that to the contrary. Katie, you're on mute.
Thank you. Again, info@pai.org if you have anything to share. So we are at time and I want to be mindful. So I'm going to wrap up our Q&A and thank Craig and Rachel for everything they've done today. And I'm going to hand it over to Nabeeha to give us some closing remarks before we all jump off. So Nabeeha?
Well, I want to thank all of you who joined us today, and we've heard a lot. There's a lot that's very difficult to reflect upon. But I also hope that we're leaving this conversation with a sense of urgency and also recognition of what the opportunity is, knowing that we're navigating a very complicated and challenging landscape here in the US and also around the world. And also a reinforcement that this moment is not the time for us to retreat, that this is actually the time for us to double down. When the question was asked about proactivity, and as we look ahead for the next 180, for me and for colleagues at PAI, it's now. It's this time when we have to do the deep work of growing our base, of expanding our reach, of bringing many more people across geographies, generations, and political perspectives under our tent. And I don't think our work can be confined to capital cities or limited to these policy circles. Really, the future of our work and our movement really depends upon building those connections and coalitions that are grounded in local communities, that are fueled by the power of young people. And I can't underscore that enough. It is a huge priority for us, is how are we bringing the next generation along here in the US to be champions for global SRHR, and also a movement that's centered in justice and collective action. Because at the end of the day, and I say this often, that the power of advocacy is not just speaking out. It's actually about building those durable, informed, and connected movements. And I think in this time, we will see where is our movement resilient and where do we need to give it some extra love and attention. So what I hope all of you take away is just a reassurance that we remain unwavering in our commitment to meet those global health needs, and also remain commitment to meeting the aspirations of communities around the world. We are a resource to you, and will continue to stand alongside you in the halls of government, in coalition spaces here in the US and abroad, and also through our partnerships with community-based organizations in over 35 countries. So we very much look forward to continuing the conversation, sharing more of our analysis tools and community briefings in the coming months. I look forward to hearing and seeing your feedback so we can also meet your interests and meet your needs. And, you know, I'm leaving reassured knowing that we're in this together. We are not letting up. And so I appreciate that you've stayed the course, that you've joined us today, and most importantly, that you remain a very, very important voice for choice. So thank you so much.